Hello, my name is Andrea Metler, and I am a registered nurse and a graduate student at Excelsior College. I am presenting my capstone project, Endoscopy Skills Day. Endoscopy Skills Day took place on November 13th. Myself and 3 colleagues presented topics in a reserved conference room, and then we also returned to the endoscopy unit to practice hands-on skills. Reacting to emergent situations quickly and accurately is a response required and needed for endoscopy staff. The hospital serves many rural communities as a critical care center with an acute care inpatient hospital, primary care, and specialized medicine clinics. The nearest Level 1 trauma center is over an hour away. Education opportunities have been identified as the endoscopy unit is growing and more patients are requiring emergent endoscopic procedures. Importantly, these opportunities were not the result of poor patient outcomes, but of nurses questioning procedures and the education and orientation they received related to their specialty role as the endoscopy staff. This also pertains to the endoscopy technicians within the department, as they have no formal college training, only on-the-job skills. Another aspect of the current education for endoscopy staff is the orientation packet isn't appropriate to this particular endoscopy unit. The orientation packet provided is from a sister hospital that was given as the systems are trying to standardize their education process. This has proven to be confusing to new staff hired, and further led to the investigation of the appropriate orientation and knowledge of the unit. This is one particular example that aligns with one of the 5 themes that were identified as challenges of continuing education for nurses in the study by Esliman, Moini, Salimi in 2015, Inapplicability. When patient safety concerns and issues are raised, it is important to identify the stakeholders involved. Of course, patients are the most important stakeholder as their safety could be in jeopardy. Secondly, the endoscopy staff. It is important to have the ability to act effectively and rapidly in emergent situations. And lastly, it is vital for organizations to revive their orientation programs that facilitate frontline readiness by encouraging nurses' competency and maintaining patient safety, as cited by Brooking, Theron, and Crow in 2018. According to the qualitative study on continuing education by Esliman et al. In 2015, continuing education includes planned learning experiences that lead to improvement of the nurse's attitude, skills, and knowledge, thereby promoting nurses' function and care plan in society. Endoscopy Skills Day provides a safe environment for staff to learn about these procedures and partake in walking through the necessary skills and experiences to provide competency in the needed areas. Applications of theory are important as they provide the foundation for changes and ideas. Kolb's theory was used as the foundation for Endoscopy Skills Day. This theory views learning as a process where knowledge is created through transformation of the learning experience, as cited by Lisko and Odell in 2010. Ironically, this theory is not specifically a nursing theory, but due to its implementation of proposed interventions based on literature reviews or best practice, it is utilized in nursing today. Specifically for Endoscopy Skills Day, the foundation of this theory provided support and understanding to the project. There are 4 key concepts in Kolb's theory and all relate to this project. First, apprehension and comprehension. According to Kolb's theory, apprehension is viewed as participation in the actual experience, whereas comprehension occurs outside the actual experience through abstract conceptualization. as cited by Lisco and Odell in 2010. As the endoscopy staff were learning, their experiences needed to be transformed. This transformation occurred as a part of extension or intention. Extension is a key concept that allows the learner to achieve extension by active external experimentation. Intention, then, is achieved when the learner reflects on the experience internally, again as cited by Lisco and Odell in 2010. According to Kolb, learning is a continuous process, and knowledge is created by transforming experiences into existing cognitive frameworks, thus changing the way a person thinks and behaves, again cited by Lisco and Odell in 2010. The outcomes delivered for Endoscopy Skills Day set the precedence for this type of learning experience to occur, and endoscopy staff to experience skills that are needed in emergent situations but not often seen in real life. Multiple references were used to complete the Skills Day in this project. Specifically, the education of myself and peers were used on the Skills Day topics. Minnesota tube, submucosal injections, electrosurgery and endoscopy tower and suite setup. An article that founded much of my evidence for this project was that by Christensen and Christensen in 2007. In this article, they identified the lack of knowledge nurses have in regards to placement of the Minnesota tube, and what the nurse does know is only based upon experience and not evidence-based practice. Again, this photo was taken at the Skills Day. A project leader, in specific a nurse leader, assesses, mentors, supports, guides, and evaluates the environment in which one works, as well as a team of healthcare professionals. In particular to this project, the project team leader, which was myself, led team meetings that included members of the interprofessional team. The project leader also delegated tasks and put the pieces together. Each team member was assigned a topic and researched the topic and provided themselves as resources and presented for the Skills Day. The project leader supported and encouraged peers and staff members to be open to a higher learning and the opportunity for Endoscopy Skills Day. System thinking provides the ability to think in systems that allow for common direction, commitment, and alignment of healthcare. This was cited by Mark Childell and Fletcher in 2016. The team members all were given a common direction as the project leader chose topics that the endoscopy staff identified as a gap in education. Next, the project leader and team members aligned their research and resources to create a presentation that lasted approximately 8 hours. Lastly, all team members were committed to solving the education gap identified and were willing to pursue the most up-to-date evidence to provide an accurate and effective Skills Day. Evaluating the effectiveness of Endoscopy Skills Day is important as it demonstrates whether or not the Skills Day delivered quality education. When assessing outcomes, appropriate assessment methods should be selected, and then measurable levels of achievement for each outcome can result in meaningful data about the outcome, as cited by Nunn, Ellison, Ard, Beasley, and Farmer in 2018. Multiple evaluation tools were used to assess the outcomes related to Endoscopy Skills Day. The outcomes are: the learner will support continuing education in the endoscopy unit. The learner correctly identifies all of the equipment used with the Minnesota or Blakemore tube. The learner demonstrates proper assembly of the Minnesota Blakemore tube. The learner properly demonstrates the setup of the endoscopy suite. The learner recognizes the use of each medication used in endoscopic injections. The learner will determine proper dilution and dosage for endoscopic injections based upon provider preference. The learner will integrate knowledge of electrosurgery and electrocautery into documenting in the EMR. The learner will identify common contraindications for electrosurgery. The learner will summarize indications for electrosurgery, including monopolar, bipolar, and argon plasma coagulation. And lastly, the learner will demonstrate proper placement of grounding pads with the use of electrosurgery. The Institute of Medicine, or the IOM, recognized the need for comprehensive healthcare delivery reform based upon research that suggested that 44,000 to 98,000 United States patients die each year as a result of medical errors, as cited by Kowalski and Anthony in 2017. There was criteria that was required for each staff member to complete prior to Skills Day. The pre-work was on a web quest that provided resources, and then a pre-test prior to Skills Day. The pre-test was embedded and completed via SurveyMonkey.com. 20 endoscopy staff completed the pre-test, and within the 20 staff, only 6 staff scored higher than 80%. This provided a baseline for the post-test that was provided on the day of education. The post-test was completed by 17 staff and yielded results of 17 staff scoring 80% or higher. This indicated the education provided was helpful and increased staff's knowledge, and the outcomes were successfully achieved. Another evaluation tool used for Skills Day was a simulation rubric. A rubric was chosen as there were 2 different evaluators. Scoring rubrics provide an assessment tool that uses clear and defined criteria that gauges student achievement, as cited by Orman and Gaberson in 2017. Following the education and presentation provided on the endoscopy tower and suite setup, staff completed the setup of the endoscopy suite and tower. Of the 17 staff that completed the simulation, all received a score of 80% or higher. Again, this indicated achievement of the outcomes related to endoscopy suite and tower setup. The last evaluation tool used to assess achievement of the outcomes related to the Minnesota tube procedure was a labeling sheet of the equipment used. As seen in this picture, this labeling sheet was given to staff following presentation of the Minnesota tube, as well as demonstration and hands-on ability to facilitate placement of the Minnesota tube on a mannequin. Of the 17 staff that completed the labeling sheet, all 17 labeled the equipment correctly. To conclude, it is important to discuss the significance and implications this project had on nursing and how it supports continued excellence in nursing practice. The significance this project had within the organization, Mayo Clinic Health System in Mankato, is the improvement and safety of patient care in the endoscopy unit. The Skills Day was relevant to endoscopy nurses and technicians' practice and ultimately helped facilitate higher levels of care to patients. This project provides other implications to nursing and healthcare beyond the application specifically to endoscopy. It provides evidence that workplace learning and specialty education is important and increases knowledge and skill of staff. Multiple staff also mentioned the improvement of morale and how being more confident in their skills could increase job retention in this specialty. Personally, this project has provided an overwhelming understanding of nursing education and the importance the educator has on their students. Utilizing technology to help educate was also an innovation that allowed for a blended learning experience that many staff had never experienced before. The casual nature of the Skills Day also provided open dialogue, many questions, and sharing of experiences that allowed newer staff to relate other patient experiences with and draw more educated conclusions. Creating this Skills Day has also delivered a more appreciative commitment to lifelong learning. After many years of education, the ability to provide education to others in this setting was humbling and very exciting. Thank you for listening to my presentation. These are the references used for the Endoscopy Skills Day Foundation, as well as this presentation and the Capstone paper. The end.